Today's online seminar, How to Start Your Own Urgent Care Business, is part of our Healthcare Happenings educational online seminar series and will be presented today by Lawrence Earl, MD, a physician executive with over 30 years of experience in owning and operating urgent care and occupational medicine centers. Dr. Earl, the floor is yours.
Great. Thank you, Crystal. And welcome everyone to our discussion today about starting urgent care centers. All right, let's move on. Let's talk about technology a little, because this is really a huge problem in a lot of urgent care centers, going with an EMR system that's really just not designed for urgent care. There really only are a few on the market, and this is not how you want to have your practitioners react when they're trying to document their visits. This can be very frustrating for physicians, and it can cause a lot of delays in patient flow, and can really bog down the efficiency and the profitability of your center if it takes a practitioner 10 minutes to fill out a chart. So these are some of the things you want to look for in an EMR system. It's got to be obviously intuitive without a huge learning curve. I've seen EMRs where it takes several days to weeks to really get comfortable with learning all the intricacies of the system, and hopefully you can learn these things in just a few minutes to a few hours. You need things like smart templates so that when you pick a condition, a good deal of the documentation is already filled out for you, and all you need to do is kind of manage some of the details. A workflow tracker so that you can see what's the status of the clinic overall, how many patients are waiting, and where are they in the flow of things. Is it time for the physician to see the patient, or is it time for the MA to do a procedure, or for the X-ray tech to take them back to X-ray? You want to be able to look at a glance on your screen and see, oh, this patient here is ready for me, I better go get in there, versus this one's waiting for a lab test, so the MA better get in there. The charge capture should be concurrent with filling out your visit. So you don't want to have to document everything and then you get at the end of the chart and then you still have to go ahead and put in all the procedures you did. It should be filling those out as you're going through the chart. It's got to be somewhat interoperable, right, with your lab. You want lab values to be coming right into your EMR. You want your digital images to be able to go out to the radiologist for overreads, and things like clinical decision support that can prompt you to keep you out of trouble for certain things. And we're not talking about a crazy amount of alerts. We just put out a blog post about alert fatigue. Sometimes you get too many of those and you start ignoring them, but real usable decision support. And it's got to be able to be, again, designed for urgent care and occupational medicine, and it's got to be fast. Again, you can't be sitting there typing out for 10 or 15 minutes. Actually see people sitting there typing, and ideally you can do most of this with a point or click type of practice. So I'll show you some of those things. So this is a screenshot from one of the EMRs that is perfect for urgent care. It's called Virgie Chart. And this would be an example of a tracking board where you can see everyone is listed here with their chief complaint, and you've got flags about who they're referred from, and you may have some special things you have to do depending on where they're referred. And then you've got very quick color-coded icons to know at a glance, do they need lab, are they in X-ray, are they ready for the MA, are they ready for the physician, what's the status of each patient, how long have they been waiting. So some kind of a tracker board like that. When you're entering orders, when you have these what are called order sets, where you pick the diagnosis and then you've got your favorite things that you typically always order for that particular diagnosis, and they don't usually vary too much, right? You get your favorites, and you want all your favorites to come up for each given diagnosis, and maybe all you have to do is say, yeah, I want all those things, or it's very easy to unclick something and then process the rest of it based on chief complaint or your diagnosis. when you're filling out these templates. Again, whatever the condition is, once you put that in, it ought to bring up the typical exam that you see, and all you should have to do is go in and make some minor adjustments, and maybe you want to either quickly type in or dictate some specifics about the history of present illness, which you can't always just click. Same thing with discharge instructions. You basically got the same things you tell patients time after time with given conditions, and you want those templated so that they're easy to come up, and then it's very easy to take out a line or whatever so you can modify it, because the other thing you don't want to do is have the exact same chart for every patient with the same condition. You do want to be able to demonstrate for compliance and regulatory purposes, as well as just for good old documentation, that you actually thought about this individual patient, and it's not just a recipe, but that you are modifying it specifically for that patient, and they're not all exactly the same. But your technology has to make that easy, and there needs to be a good reporting mechanism for everything that you're doing that can tell you how many patients you're seeing and what's the flow and how long are they waiting, and it has to have a really good reporting mechanism so you can identify what's working in your practice and what's not working in your practice. Okay, so those are some highlights on the EMR, and I'm going to stop here with my favorite lab partners, and I think we have a little bit of time now to take some questions.